Estradiol Patch, Transdermal Semiweekly is a hormone, estrogen, medication used by women to help reduce symptoms of menopause, such as hot flashes and vaginal dryness. These symptoms occur when the body makes less estrogen. If you are using this medication to treat symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. This medication may also be used by women who are not able to produce enough estrogen, for example, due to hypogonadism or primary ovarian failure. Additionally, certain estrogen products may be used by women after menopause to prevent bone loss, osteoporosis. However, there are other medications, such as raloxifene and bisphosphonates including alendronate, that are also effective in preventing bone loss and may be safer, and should be considered for use before estrogen treatment. Before using this medication, always read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. To apply the patch, peel off the backing and place it on a clean, dry area of the body as directed. Different brands of patches are applied to different areas, so if you're unsure, ask your doctor or pharmacist for guidance. Press the patch firmly in place for about 10 seconds to ensure it stays on. Avoid applying the patch on the breast, oily, broken, or irritated skin, and areas where it might easily come off. The patch is usually replaced twice a week, so follow the dosing schedule carefully. The dosage will depend on your medical condition and response to treatment. When replacing the patch, apply the new one to a different area, and wait at least 1 week before using the same area again. Dispose of the old patch away from children and pets, and do not flush it down the toilet. If the patch falls off, reapply it to a different area. If it doesn't stick completely, apply a new patch and wear it for the rest of the scheduled period. Do not wear 2 patches at the same time. Use this medication regularly to get the most benefit from it. To help you remember, change the patch on the same days each week and mark your calendar as a reminder. If your condition does not improve or worsens, be sure to inform your doctor. Some common side effects of the estradiol patch, Transdermal Semiweekly include skin redness or irritation at the application site, nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist right away. It's important to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. However, if you experience any serious side effects such as persistent nausea/vomiting, mental/mood changes, breast lumps, unusual vaginal bleeding, severe abdominal pain, or yellowing of the eyes/skin, it's crucial to seek medical attention immediately. Rare but serious side effects may include problems from blood clots such as heart attacks, strokes, or pulmonary embolism. Seek immediate medical help if you experience symptoms such as chest pain, sudden severe headache, weakness on one side of the body, trouble speaking, or sudden vision changes. While allergic reactions to this product are rare, it's important to seek medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. If you experience any other effects not listed here, be sure to contact your doctor or pharmacist. Estrogens, whether used alone or with another hormone, can have some serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogens should not be used to prevent heart disease or dementia. Using estrogens can increase the risk of cancer of the uterus. However, taking a progestin as directed by your doctor can help decrease this risk. If you experience any unusual vaginal bleeding, be sure to tell your doctor right away. In postmenopausal women, using estrogens, with or without a progestin, can increase the risk of cancer of the breast/ovaries, stroke, dementia, and serious blood clots. When used with a progestin, estrogens can also increase the risk of heart disease. The risk of these serious side effects may depend on the dose of estrogen and how long it is used. It's important to use this medication at the lowest effective dose and for the shortest amount of time. Be sure to discuss the use of this medication with your doctor and check in regularly, for example, every 3 to 6 months, to see if you still need to use this medication. If you will be using this medication long-term, you should have regular complete physical exams as directed by your doctor. Before using the estradiol patch, let your doctor know if you have any allergies or if you are allergic to estradiol. Also, inform your doctor about your medical history, especially if you have a history of certain cancers, blood clots, heart disease, liver or kidney disease, high blood pressure, diabetes, or any other health conditions. It's important to avoid smoking or using tobacco while using this patch, as it can increase the risk of certain health issues. If you are planning to have surgery or if you will be immobile for a long time, talk to your doctor as you may need to stop using the patch or take special precautions. Additionally, if you are going to have an MRI test, inform the testing personnel that you are using the patch. It's also important to limit your time in the sun and use sunscreen, as this medication may cause blotchy, dark areas on your skin. If you wear contact lenses, you may experience vision problems, so contact your eye doctor if needed. Lastly, this medication should not be used during pregnancy and may pass into breast milk, affecting its quality and amount. Talk to your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without your doctor's approval. Some products that may interact with estradiol patch, Transdermal Semiweekly include aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, this medication may interfere with certain lab tests, which could potentially cause false test results. Make sure to inform lab personnel and all your doctors that you are using this drug. If the patch is chewed or swallowed, it can be harmful. If an overdose occurs, the patch should be removed if possible. In the case of serious symptoms like passing out or trouble breathing, it is important to seek immediate medical help by calling 911 or contacting a poison control center. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can contact a provincial poison control center. This medication patch needs to be used carefully to avoid any potential harm. It's important to not share this medication with others. While using this medication, it's essential to have regular complete physical exams and medical tests, including blood pressure checks, breast exams, mammograms, pelvic exams, and pap smears. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. Preventing or controlling high blood pressure, high cholesterol, and diabetes can help reduce the risk of heart disease and stroke. Lifestyle changes like reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking can be beneficial for your health. Keeping your mind active with mental exercises, such as reading and solving crossword puzzles, can help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. To help reduce hot flashes, lifestyle changes such as stopping smoking, dressing lightly or in layers, avoiding/limiting certain foods like spicy foods, caffeine, and alcohol, reducing stress, and exercising regularly may be helpful. Promoting healthy bones can be achieved by increasing weight-bearing exercise, stopping smoking, limiting alcohol, and eating well-balanced meals with adequate calcium and vitamin D. You may also need to take calcium and vitamin D supplements and make lifestyle changes, so it's important to consult your doctor for specific advice. If you forget to change your patch at the usual time, make sure to replace it as soon as you remember. And remember, never use more than one patch at a time. When storing the estradiol patch, Transdermal Semiweekly, it's important to keep it at room temperature and not remove the patch from the pouch until you're ready to use it. Make sure to store all medications in a place that's out of reach from children and pets. It's important not to flush medications down the toilet or pour them into a drain unless specifically instructed to do so. When you no longer need the product or it has expired, be sure to properly discard it following the instructions in the How to Use section. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.